Hi, I'm Laura. I'm one of the nurses here at Christie Clinic in OB. Today we're going to be teaching you about how to use a glucometer for glucose testing when you have gestational diabetes. Today Whitney is going to be my example patient for the teaching. The doctors here at Christie want their patients testing 4 times a day. First thing in the morning fasting when you've had nothing to eat or drink, and they like that value to be less than 95, and then 2 hours after the 3 additional meals for the day, and they like that value to be less than 120. The doctors may change the amount of and frequency that you are testing each day, so just make sure you bring those glucose log sheets to every visit with you. Now we're going to show you how to use the glucometer machine. When you come in for your teaching with the nurse on the glucometer machine, you're going to bring in your own personal machine that we have called into your insurance. Not every machine is going to be the same that's covered by your insurance type. It's going to vary, but every machine will have instructions on how to use the glucometer within the packaging. This is going to be your actual glucometer device. Also in your package, you're going to have your your testing strips, and then your lancets, which are the actual needles that you use to prick your finger. And you're also going to have a lancet device. When checking your glucose levels, we always want you to test on your fingers. You need to be rotating the sites daily so that way you don't develop hard calloused areas. And also, we recommend that you test your glucose levels on the sides of your top of your fingers. We don't want you doing on the pads as they will become very sore over time. Before you check your blood glucose level each time, you need to either be doing very good hand hygiene with washing your hands for 15 seconds or longer, and then you can do just alcohol prep pads, which you can get at your local pharmacy. So Whitney is going to wipe off her finger that she wants to test, and staying on the outer top portion of the finger. Next, you want to take your lancet device and pull off the top. You want to take your lancet, keeping the circular portion up, and push it in until you hear the click. Then you twist off the top, exposing the needle. And then put the top of the device back on. On the sides of your lancet device is a dial, and it's going to have numbers on there. 1 and 2 it's going to be the depth of how far the needle is going to go into your skin. Most people can't break their skin at 1 or 2 because the needle is so small. So we recommend starting at a 3, and some people may even need a 4 if they have thicker skin or callous fingers, anything like that. But you can start at a 3, or if you even want to start at a 2, that's fine. So once you pick your number that you want it to be on, you just pull back on the bottom of the lancet device, and that prepares the needle. Then you want to turn on your glucometer. Once you turn on your glucometer, you can get out your testing strips. You want to keep the butterfly facing up. The thick black portion on the testing strip is the one that you're going to insert upwards in the bottom of your glucometer so it comes out looking like this. Once that's ready, it'll actually show a blood drop and it's ready for your blood draw. Now, before you test each time, you need to make sure that the alcohol or your hands are completely dry, or else it can give you a false result. So now that we're ready, Whitney's going to test her finger. You press it against there, push the button, and it releases the needle. You may have to squeeze a little bit to get enough blood out. Then you take your device and you just lay it next to the blood drop. It'll beep when it's ready and it'll start calculating. And then you get your glucose result. No matter what glucose result you get, we want you to write it down on each designated spot that the doctors want you having your glucose readings resulted in. And then also you need to put the date each day and bring each one of those. It's very important to each visit with the provider. And also we're going to talk about what you do with the used testing strips and lancets. Each time you test your glucose, you need to get a new lancet and a new testing strip. Never reuse them, as that can give you a false result. After you're done with those, you need to throw them away. When you come in for that visit, the nurses here will give you a biohazard container to use for disposal, and we'll also talk to you about other methods of disposing this waste product. And you need to just make sure whenever you keep it at home that you keep it very secured on the top with a piece of tape or something. The top lid is very secure so no one else can be exposed. And everything else, if you have any questions, you can always call us, and then we will discuss everything again at your visit with the nurse.